Hey everyone, it's Dr. Hodges, and this is a little quick tip as I'm doing my follow-ups on this wonderful Friday. I'm usually seeing my 1 week and 1 month follow-ups in the morning, and I've seen this a couple of times, so this is a little public service announcement. If you've recently had surgery and there are some medications that you normally take on a regular basis, it's important that you go over your medications with your doctor after your surgery. I know after weight loss surgery, if you've been taking high blood pressure, diabetes, high cholesterol, oftentimes we'll take you off those medicines because with the surgery, those disease processes go into a remission. However, if you've been treated for 8 years, or pardon me, if you've been treated for 9 years or more, you may still need to remain on some, if not all of them, or the doses might need to be tweaked. So that's one thing. I think the other thing to know is if you take any medication for anxiety or depression, particularly SSRIs, so if you're on Prozac or if you're on other types of medicines like Wellbutrin, if you have stopped those for whatever reason after surgery and you haven't restarted those, you can get withdrawal side effects. So if you present to your doctor and it's a week or two after your surgery and you're having kind of more a persistent nausea, maybe you're having restless leg, just other GI complaints, you could be having a little bit of withdrawal because you haven't restarted some of your depression or anxiety medicine. So make sure that you talk with your doctor about all the medicines that you take on a regular basis and which ones you need to hold and which ones you need to restart. For me, as a general rule of thumb, if you are on thyroid medicine after surgery, you need to resume that. If you take anything for anxiety, depression, bipolar, any of the psych meds, you definitely need to restart those after your surgery. The jury might be out a little bit on blood pressure, diabetes, and high cholesterol medicine because it really depends on your health history and how long you've been treated for those meds. So just a little PSA and a little word to the wise. And happy surgery.